It was the couple of weeks before he passed. He was having some hard times with flashbacks and different things that had happened at work. We had talked at length about a lot of different things, and him going to a therapist or going to the doctor and different things. But it just got to the point for him, I think, where at that point I don't know if he was too proud or just didn't want to reach out for the proper help.
Constable Broderick isn't alone. Officials say reaching out for help is one of the biggest challenges officers face when dealing with trauma and PTSD.
Is that we have to get to a place where people understand that it's okay to say, I got to put my hand up and I have to take a knee because I got to get my health in order. And then, in some cases, members have to leave the workplace for a period of time. And we have to understand, and we have to, within our police organizations, building capacity to understand that police officers and civilian members are exposed to trauma, and if they need to get the proper mental health support, sometimes that means leaving work. What happens is, when we haven't built in capacity within our police services, people feel guilty. They don't want to leave work because they know that they're leaving their colleagues shorthanded.
Sergeant Brendan Johnston was recently honored for going above and beyond to support Constable Mike Broderick's widow, Erin, after Mike died by suicide. Johnston says when it comes to offering members help, there's a disparity in the level of support some services can provide.
We're a small service. Some of the larger services are able to employ, psychologists and psychiatrists on their staff, where we don't have the ability to do that. So whether we could partner up with a bigger service, or we can partner up with some sort of an organization that would help us, that would be fantastic.
Our colleagues with the Ontario Provincial Police Association have a great program where their members have 24/7 access to mental health supports, and we need to roll something like that out for all of our municipal services.
Chief Mark Mitchell admits they still have a long way to go.
I think some of the recent announcements, demonstrate some positive steps that have been taken, and I look at it as a joint responsibility. Police services, police associations, individual members, legislators, the Police Association of Ontario, we all have a role to play in improving that environment. We can't take away the trauma that officers are going to be exposed to, and we need to get better at helping them deal with that in a healthy manner.
The province recently announced $45 million in mental health funding for first responders, as well as plans to build a dedicated mental health facility.
Right now, there's a gap that exists within the mental health system. One of the problems that happens now is we have a police officer that's in crisis. We don't have anywhere safe to take them. And the government has been, has some initiatives on the go, and they're looking at, they've made a commitment to build a first responder facility that's going to be housed in Caledon with 40 safe beds just for first responders. That's a really big step.